A 55 years old lady present with neck mass. On examination, there is swelling of the neck, enlarged deep cervical lymph node. A biopsy taken from the node and it noted that CD20 positive. What is the most likely underlying diagnosis? Here are the options. Options are Hashimoto thyroiditis, thyroid gland lymphoma, papillary thyroid cancer, follicular thyroid cancer, and anaplastic thyroid cancer. So what may be the option here? Key point is, first of all, neck mass. That means neck mass, most of them are thyroid gland. There may be another neck mass, such as it may be development from the lymph node enlargement, it may be branchial cyst, and it may be any other swelling such as the sternocleidomastoid tumor, it may be carotid body tumor. But the neck mass, the most common neck mass is the thyroid gland, and there is also enlarged lymph node. So a biopsy is taken and there is CD20 positive. So first of all, let's see the lymphoma. These respond well to combined chemotherapy, chemoradiotherapy. That means in case of lymphoma, the usual treatment modalities is the chemotherapy, chemoradiotherapy. Radical surgery is unnecessary. That means the radical surgery usually not helpful in this condition, because the lymphoma, it circulates through the blood. Once the disease has been diagnosed on the biopsy material, such biopsy material is not generated by FNAC, a core biopsy is required. So in case of the lymphoma, there is core biopsy required. Usually what we do, in case of the thyroid gland, we usually take the biopsy, but when there is suspected case of the lymphoma, we should go for the core biopsy, because in the FNAC it is not possible to identify the lymphoma. CD20 cell lymphoma, CD20 is a B cell lymphoma marker, and it is useful histopathological analysis of the biopsy. So CD20, it is the indicator for a lymphoma, because we know there are different type of the CD, such as the CD1, CD2, CD3, CD8, CD20, CD30. This is the cluster differentiation of the lymphocyte. What occurs? That means a group of lymphocyte is present like this, and a group of lymphocyte may be present like this, a group of may be present like this. So according to the cluster, they are numbers. So the CD20, it is a group of the lymphocyte, and it is a specific pattern present. So in this condition, the all type of CD, they are the lymphocyte. So in case of this CD present, when there is CD present in this condition, go for the lymphoma, because it derived from the lymphocyte. And the follicular lesion tends to lymphatic involvement. That means the follicular carcinoma, there are two important type of the carcinoma present, and the follicular lesion tends not to lymphatic involvement, and this same is true of the Hashimoto. In case of the follicular thyroid cancer, and also in case of the Hashimoto thyroiditis, in this condition, this type of lymphatic invasion or lymphatic involvement not present. And the papillary thyroid cancer, it lymphatic involvement, that means the lymphatic spread, but not it involve the lymphocyte. So this point is very, very important. And here we can see the classification of the lymphoma. The primary thyroid lymphoma, they are classified in the B cell lymphoma, and it is the most frequent, and another one is the T cell lymphoma. And B cell, T cell, they are the subdivision of the lymphocyte. That means B lymphocyte and T lymphocyte. So B lymphocyte and T lymphocyte, they causes the lymphoma, and they especially acquainted by the CD. That means in this case, always CD present. That means from CD1 to a definitive number of the CD. That means the different type of the lymphocyte present, such as one group present like this, another group present like this, another group present like this. So according to the cluster, that means a group of lymphocyte present, according to the orientation, according to the presentation, the CD name given, and such type of huge number of CD present, such as CD70, CD69, CD64. So a number of the CD present, and when there is CD, go for the lymphocyte. It may be B cell lymphocyte or B lymphocyte, and it may be the T lymphocyte. So what is our answer? Only this point is enough to answer the question, which is the CD20 positive, which is the thyroid gland lymphoma. Other option here, such as the Hashimoto follicular anaplastic. In this condition, such type of of the CD not present.